Cancer, you know, remains a silent crisis, claiming an estimated 78,000 lives annually in Nigeria. Many due to late detection, poor funding, and limited access to treatment. But in the midst of these challenges, one woman's advocacy has helped change the narrative. Former First Lady of Kebbi State and founder Medic Aid Cancer Foundation, Dr. Zainab Shinkafi-Bagudu, has led campaigns across the country. Just days ago, she called on state governments and development partners to ensure the early release and prudent use of funds for cancer treatment. Dr. Zainab Bagudu joins me now on Beyond the Headlines. She's also set to make history in 2026 as the first African president of the Union for International Cancer Control. That's the world's oldest and largest global cancer organization. Dr. Bagudu, thank you for joining us on the program.
Thank you for having me, Nifemi. It's a pleasure.
You recently urged state governments and their partners to ensure the early release and prudent use of cancer treatment funds. What specific lapses or delays are you seeing in how these funds are currently being managed?
Well, funding is a huge and critical issue for us cancer advocates and indeed for cancer patients. The federal government of Nigeria has a very innovative funding mechanism known as the Cancer Health Fund, which seeks to address indigent patients. There have been delays in disbursement of the funds to the patient's wallets. How it happens is that there are 6 or 7 tertiary hospitals, mainly the first generation ones like Ibadan, Benin, ABU. Those are the ones that have access to it. And the wallets, the e-wallets of the patients are credited with the funds. Last year, there was a delay because of the reconstitution I think there was a reorganization of the way the process works. But right now, it's going smoothly. An external consultant handles it, MG Consultants, and the monies go, the application is made by the consultants in the hospital, depending on the cancer patient's case. But by no means are these funds enough. On average, a patient gets 1 million naira. Just to put it in perspective, a cancer patient with breast cancer, a woman with breast cancer, say even stage 2, needs about 25 million naira to go through the first round of chemotherapy, surgery, and so on. If she needs a further assessments and treatments, then it's going to be higher. So you're getting 1 million, 2 million, at the most 3 million. It's not going to cover the great requirements.
Absolutely. This health fund was launched years ago to support patients, but the truth is that many Nigerians don't even know it exists. And there are conversations around why this fund has remained largely invisible and how we can make it even more impactful. But given the economic pressures states face, because you have been a First Lady yourself, how do you think governors practically can prioritize cancer funding without neglecting other health burdens like malaria or maternal health?
Well, it's an issue, I agree with you, not just health burdens, but as you rightly said, having seen the issues that our leaders face, you know, you have insecurity, you have to talk about education, you want to talk about feeding, and all is coming from that same one pot. So there has to be a lot of advocacy from civil society, from other stakeholders, the traditional rulers, the cancer patients themselves. They have to push for that funding. In Kebbi State, we're able to institute an indigent patient fund. And as First Lady and a member of First Ladies Against Cancer, all the flag states, we advocate to the governors. It's easier for us. We're not denying it. Yes, there are spouses. So when we advocate, we get funding into a pot. But how do you sustain that? We must look at partnerships, looking and seeking for partnerships within country, outside country, working with private sector, international donors. But for us to be credible, we have to spend our funds in a transparent way, and we have to account for it. So data, if we get 1 million naira, let us account for how that 1 million naira is being spent. And that's where we usually fall short in Nigeria.
You have identified that that awareness is critical, right? But we also know that awareness alone can't cure the disease. Precisely how do we begin to bridge that gap between awareness and access, particularly in rural communities where screening centers are few?
Well, we have to strengthen our healthcare system, and funding, again, funding is not just about, having the money, but how do we advocate for that money? We need to talk to our legislators, both at the state and national level, to ensure that they're putting more into that pocket. Looking at the rural areas, we just have to keep on doing more and strengthening our primary healthcare system. There is some screening going on and vaccination that will help us in early prevention mechanisms. But we have to, there's still a lot of gap at the primary healthcare level. We don't have a strong screening system, and by creating, the atmosphere and training our healthcare workers, the lower ones like the community health extension workers, the nurse in the rural area. A lot of states are doing that now, but it's still not enough. You see, Nigeria is so huge. We have to do put in that extra effort if we're going to see tangible results in cancer control.
Over the years, we've seen you mobilize women leaders, corporate partners, and even faith-based groups in this cause. What model of public-private partnership do you believe can sustain cancer control in the long term beyond donor cycles?
Well, donor, when you say donor, do you mean just funding? No, there's so much that everybody can give in now. To me, you are a partner, Nifemi. You're giving me a platform to talk about this. It might not get to the inner areas, but there are other platforms that will help us to achieve that. So everybody has a role to play, and we can identify what is your strength and how is it going to help us by having, social media events. There are some events that targets. We have a huge walk which we just had this October, and it's the loudest work program in my foundation. And people always ask, why do you do it in Abuja? It's the city, the people are in the rural areas. But there are other programs that is targeted for Abuja, and that is why it is loud. We're not going to come to Abuja with a village chief and say, go door to door and talk to the people. They won't even let them into their houses. But the houses in Abuja will hear the huge sound on the road. They will identify with the celebrities that we bring, and then they will ask, what are they doing? Meanwhile, if it's in a village in Kebbi, I will go to the village head. So everybody, all the stakeholders are very critical. The role that each person, or the extent to which your role goes, is now left to us as a health system, as leaders, as advocates, to put it together. We're doing a lot, but it's all happening in silos. I was just on a meeting talking about the Cervical Cancer Elimination Day of Action, which is November 17th. So how we're going to put together all the good work that Nigerians are doing across the country was what was being discussed. So we do have the assets. It's just tying it and reaching deep into our resources to make sure that it translates into national action.
Claiming an estimated 78,000 lives annually in Nigeria, is there a sense to which you think it's not getting the kind of priority it demands from government, especially investing in homegrown cure and also paying attention to the factors that is actually spreading this disease?
I mean, it's very easy to say yes, but I've been in the field and I know. It's not the government has its own role to play, but the individuals, the carers, the doctors and the radiologists, they also have their own role to play. We're seeing a lot of professional flight out of the country. There are push factors. At the same time, there are pull factors. There's no way the Nigerian government is going to compete with the salary that a doctor is earning in Australia or in the UK, because our resources and our system is just not the same. Our people don't pay taxes. The NHS is funded by taxpayers' money, but we don't have that kind of funding directly into our health system. But having said that, there's a lot more that government can do in relation to, improving things as they currently stand. We have a lot of resources, I keep on repeating, but we're not harnessing them and pulling them together.
By the way, let me say congratulations, because you are president-elect. In October next year, you'll become the first African president of the UICC. Some say it's a crown that fits you well, considering the investment you have made over the years. What priorities will you push at the global level to make cancer care more equitable for low and medium or middle-income countries like Nigeria?
Thank you for that. The UICC is a global organization that is focused on, it's the largest global organization of cancer bodies, and it focuses on capacity building and creating awareness. Most of all, it works with global initiatives and translating them through its membership to national-led action. And for me, coming from a low middle income country like Nigeria, I have decided that we're going to be doing a lot of community-based capacity building. Community-based capacity building for our people, the members of the community, which means teaching them about cancer and the signs and symptoms and how to assess the care that is available. So navigating community-based intervention for the healthcare workers. That is so important to me, because that is where the bulk of the burden lies. In one of your introductions, you mentioned that 75,000 Nigerians die from cancer. And indeed, that's what's on the IAC site, on the official registry. And I think the number that are diagnosed is about 120,000. But when you compare Nigeria to a country like Brazil, which has equitable population, Brazil is reporting 400,000. Similar demographics, similar genomics. Where are the rest of Nigeria? 430 actually versus 120. The data is weak, and we're not capturing all the cancer patients. And it's very clear. A lot of people are in our villages, undiagnosed, untreated, and they're dying. So we have to really look into that, and that is one of the priorities that, as UICC president, I will be focusing on, how to work more at a community level so that our voices can get to a global stage, and then we'll be able to also build the capacity of our doctors and nurses and so on in the country. And the UICC has the ability to do that, and I really very much look forward to doing that. There are also a lot of access programs that are ongoing now, like ATOM. Unfortunately, Nigeria is not one of the beneficiary countries, but there are other low middle income countries. And I'm always being told that as UICC president, you're not Nigerian president, but it's very difficult to dissociate from my view. So, but I will be looking into that, especially from my colleagues in Nigeria and my friends.
So for the purpose of the other, countries of the world that might see this interview, it is from Kebbi to the world, and the world will now look to you not just as a leader, but as a voice for underrepresented health systems. Walk us through how you intend to ensure global cancer advocacy translates into real national policy action, especially on the continent.
Well, thankfully, nowadays, there's so many ways we can do that. We have the power of the internet, technology. Webinars are very easy to organize, and then we're always having convening events. We have exchange of knowledge. We go to South Africa, they come from Kenya, we go to Mali. Travel can be a bit difficult in Africa, but we manage to do it a lot. Cancer advocates, we travel a lot, and we travel to get our voices heard, to share experiences. And one thing that I would really like to see happen is South-South collaboration. We're always talking about help from the West, and it's, the resources that are being expended from the West to Africa and other low middle income countries is really quite negligible when you look at the scale of the problem. we need to really scale it up. If we're going to be assisted, then we need to be assisted properly. And it's not about loans that we have to spend the rest of our lives paying back. And then also our own internal resources can be put to better use. So I think that by having all these type of capacity building sessions, webinars, and convening events, we'll be able to do better.
We have to go now. By the way, do they still call you?
Thank you.
Do they still call you Madam First Lady? Because
no,
because
former
First Lady, because the name was so changed to.
I always had
Madam
a thing
President.
about that First Lady title.
Okay.
I prefer I prefer doctor, because
Doctor,
that's for life.
But from next year it will be Madam President. We have to go now, but you know there are many.
Thank you.
Many Nigerians living with cancers today still feel isolated, financially, emotionally, socially. What message do you have for survivors and caregivers who are watching this show right now? In 30 seconds, if you can.
Well, the message is simple. Don't give up hope. It's tough having cancer, but you're tougher, and you always have the strength to beat that disease. Surround yourself with people that love you, and make sure that you are able to fight this disease from the very best, with all the best that you have to give. We can do it. Together we're stronger.
From our First Lady, Kebbi State, founder, Medicaid Cancer Foundation, Dr. Zainab Shinkafi-Bagudu, who's also president-elect of the Union for International Cancer Control, the first African president come 2026. Thank you so much for talking to us on Beyond the Headlines.
Thank you.
That's our show today, everyone. Remember, you can see it again tonight at midnight and also 6 a.m. tomorrow. I am Nifemi Oguntoye. See you again soon.